Hello and welcome to the Proactive Patients. I was actually researching to try to see what information is out there when someone has a family history of cancer, but does not actually have any identifiable hereditary cancer. Maybe they've done genetic testing, came back negative, still have a little bit of family history, or maybe even just have a close relative who's had cancer. There is very little information on this scenario where there is a family history, but nothing hereditary. This does still change a person's risk. I'm Cindy, I'm a certified genetic counselor, and started this channel to help you take charge of your own cancer prevention. Now, there are some cancers that are obviously more environmental. If you have lung cancer in the family and they were all smokers, or they had some other exposures that might increase the risk for lung cancer, that's one thing. But what if, say there's no other history there, dad had colon cancer, he was maybe 60, 70 years old, are you still at increased risk? Or what if mom had breast cancer? Again, maybe she was 50, 60, 70 years old at diagnosis, and how does that impact your risk? Even if there's nothing hereditary, 90% of cancers are not hereditary. About 5 to 10% are. Some cancer types higher percentage, some a little lower. But that doesn't mean that if it's not hereditary, it can't impact your risk. People in the same family can have similar environmental exposures, lifestyles, some biology that may go into maybe even some minor genes that we don't understand yet. So by the way, I'll never say it's not hereditary, but for most people, it's a combination of factors. Guess what? If you have a close family member with a cancer, you have a higher chance to have a similar combination of factors in common with them. So this can impact your risk. Doesn't mean it will happen, but what should we be doing about that? And how do you know what types of risks? So there is something called familial cancer. And the familial cancers are like little clusters of the same type of cancer in a family. So say if two women have had breast cancer who are closely related to each other, that might not be because of one gene involved, but like I said, that's still a little cluster. And any first degree family members, any sisters, daughters, mothers of people with breast cancer do have an impact on their risk. Sometimes you see that with a cluster of colon cancers in family. There may be two brothers who've had colon cancer. And it may not be one gene involved. It may just be they've had similar lifestyles and environments growing up. Maybe there's some biology that goes into it, but like I said, similar combination of factors. What does having a close family member with cancer do to your cancer risk is really the big question. For some individuals, the family history of cancer actually doesn't meet criteria to do a hereditary test, but might still warrant changes to their screening recommendations. So if you do have a parent or a sibling or a child with a certain cancer, your risk for that type of cancer, not for all cancers, but for that type of cancer, doubles. How much that really plays a role in risk does kind of depend on how common is that cancer. If it's a very rare cancer where say, 0.1% of people get that type of cancer and we're doubling that risk because your child had it, well, guess what? You're at 0.2% chance to get that type of cancer. So it's still pretty low. What if that is a more common type of cancer? What if your sister had colon cancer? How does that impact your risk? The general population chance for colon cancer is like 3 to 5% of people get colon cancer. Siblings or children or parents of someone with colon cancer may have up to 10% chance to get colon cancer. So that has a little bit bigger impact than for the rare cancers. Why is there this impact here? Well, most cancers don't have one hereditary cause. Most are actually a buildup of problems over time that lead into cancer. In fact, for many cancer types, there are some exceptions to this rule, but for most cancer types, the number one association we know of for cancer is actually just age. The older we get, we have a higher chance to have random things build up, environmental things build up, just a combination over time that could lead to a cancer. And the thing is, relatives may have some similar things in common, whether it's random things are random, but environmental things, well, we grow up in the same households as our siblings typically. We may all have been exposed to certain things. Or we may have similar lifestyles, similar taste in food and smoking habits or other habits that can play a role definitely still build up over time. The chance to have a similar combination of more minor factors does increase for close relatives. So actually, if you look at the most common cancer types, by the way, for women, the most common type of cancer is breast cancer. It's about 12.5% of women get breast cancer in a lifetime, regardless of family history. There's a reason why they do suggest all women should be doing some sort of screening to catch it early. But if a woman has a mother or sister who's had breast cancer, she could have 20 to 30% chance to get a breast cancer in a lifetime. That's like 1 in 3 to 1 in 5 women. That's pretty common. You can actually argue very similar for prostate cancer. About 12.5% of men get prostate cancer at some point in their lives. Yes, prostate cancer tends to be a little less aggressive than other types most of the time, not all the time, but it's easy to screen for. Guess what? If you have a close family member, say you have a father or a brother who's had prostate cancer, you may have up to 25% chance to get prostate cancer. So maybe it's worth that extra screening, maybe starting that screening a little earlier. Colon cancer, we already mentioned, but you can say the same things. Uterine cancer, the general population, 2 to 3% of women get uterine cancer. Women who have a mother or sister who's had uterine cancer, about 4 to 6% will get uterine cancer. For ovarian, about 1 to 2% of women in general get ovarian cancer. For women who have a mother or sister with ovarian cancer, it's probably 3 to 5%. Pancreatic cancer, 1 to 2% get pancreatic cancer in general. If there's a close family member with it, maybe 2 to 4% chance to get it. So you can see bumps in these risks for these different cancer types. Although, yes, it has a higher impact the higher the baseline is. So the bigger question here is, okay, now that we know if I have a close family member with a certain cancer, that does change my risk for that type of cancer. The big question, what do we do about it? So we do have guidelines based on family history alone for certain cancers, or for other cancers based on a combination of family history and some personal risk factors. Like for breast cancer, we have some models that can estimate a more personalized lifetime chance. Based on that, we have recommendations to adjust our screening. Any woman who's estimated at having a 20% or higher risk for breast cancer probably should do breast MRIs in addition to mammograms every year. Anybody who has a close family member with colon cancer, guess what? They should be doing colonoscopies every 5 years and starting at an earlier age. For prostate cancer, we start at an earlier age and make sure you get your PSA testing every year. What we'll be doing with this channel is we're going to go into each of these cancer types and how you might know if you're at a higher risk, how do you get that information, how you get those recommendations, and what should you be doing. So stay tuned for future videos on this in more detail for each cancer type. Please subscribe if you find that helpful information, and make sure that bell icon is clicked so that you get notifications. Alternatively, I do have a newsletter where we will send out weekly updates on what we've released that week, as well as extra tips within that newsletter. I'll link that below, but we'll see you with our next video.